CA4948 is a small molecule inhibitor that's specific for an intracellular target called IRAK4. IRAK4 is part of an inflammatory transcriptional bundle, traditionally called the inflammatory myddosome. This myddosome is really the transcriptional pathway of toll-like receptor signaling or IL-1 receptor alpha signaling. So potent inflammatory signaling often goes through this mydosomal cascade that inevitably uses IRAK4 to translocate to the nucleus. Inside of the nucleus of a cell, it causes an upregulation of inflammatory cytokines, namely nuclear factor kappa beta. Some cancers mutationally upregulate this, like lymphomas, as a growth advantage, but other cancers like melanoma, we've discovered also express high levels of this based on the inflammation in the inflammatory nature of the tumor microenvironment of melanoma. This upregulation leads to tumor growth, proliferation, and until our study, this had never been shown in melanoma brain metastases. So what we first started with doing was finding whether or not IRAK4 was upregulated in melanoma brain metastases using patient samples, and we found that there was a high degree of expression in those patients. And then we looked downstream at the proteins affected by IRAK4 signaling and found that all of these inflammatory proteins related to nuclear factor kappa beta were also upregulated, but there was also some degree of self-regulation that the cell was trying to undergo to suppress that. We next looked to see whether or not the drug, the CA4948, could get into the brain. And we did these in both naive and tumor-bearing mouse models and found that it rapidly passes through the blood-brain barrier. Once it's in the brain environment, it then persists at a physiologically relevant level of suppressing IRAK4 for 8 hours, even after just a single oral dose. Now, this drug's currently in clinical trials for both acute leukemia and in aggressive relapse refractory lymphomas, so we know it's very well tolerated and very well handled by patients. We then next look to see, well, what does this effect have on these cells? And we used this aggressive melanoma model of B16F10 cells and C57 black 6 mice that had tumors implanted. And then we treated them with either a vehicle control or daily CA4948. And what we found is really profound suppression of growth in these mice that were receiving the treatment versus receiving placebo. And that this treatment led to a statistically significant survival advantage in these mice. But there's some other research that had been done by other groups that showed that this inflammatory signal is also really relevant to suppressing how effector T cells function through checkpoint inhibition. So it upregulates PD-1 expression in the tumor microenvironment through TAMs, and then that causes this suppressive effect on how well T cells are going to work, which then leads to the inability of T cells to be activated by checkpoint inhibitors. So we studied whether or not the combination of the CA4948 with an anti-PD-1 antibody was beneficial to melanoma. And what we found is that not only slowed growth, but actually caused tumor regression in subcutaneous tumors. So we're really excited about the potential of CA4948 in combination with immune checkpoint inhibitors for patients with melanoma brain metastases, because very few agents can effectively get to the brain and treat this population. We also, interestingly, have shown that one of the mechanisms that this is working in through the cell is through inhibition of MAP kinase and some other escape pathways that are frequently mutated in melanomas and most frequently upregulated in BRAF positive tumors. That's 50% of melanomas are the BRAF positive tumors that upregulate these pathways, and CA4948 might be another option at targeting those pathways and inhibiting how those cells grow.